As you know, the issue of physician compensation has been a matter of discussion for our government since last August, when the McKinnon report was released. The McKinnon report confirmed that we pay physicians at much higher levels than the other big provinces in this country. But it also showed that the problem isn't just the amount that we spend. We have governance issues as well, which have prevented us from making changes in outdated physician benefit programs and administrative fees. And we lag behind, badly behind, the rest of Canada in the use of alternative relationship plans. The report also made a more basic point. There's enough money in the health system. We should be able to hold the line on spending and move toward the per capita levels of the other big provinces over time. We'll spend $5.4 billion on physician services this year, and that's a quarter of the health budget, or 10% of the entire Government of Alberta budget. As the McKinnon panel highlighted, physician spending has grown by nearly 300% since 2002, faster than any other province. An Alberta physician earns about $90,000 more every year than a doctor in Ontario. And more importantly, at existing growth rates, we would spend another $2 billion in the next 3 years beyond the current $5.4 billion. And that's just not an option. This compensation model is broken, and so we're fixing it. We told the AMA from the outset that we had to hold the line on spending, not to reduce it, but to hold it at the current level, the highest level in Canada. But at no point in the negotiations or the mediation process did the AMA come to the table with any meaningful proposals to meet that fiscal imperative. So today I'm announcing that we will introduce a new funding framework effective March 31st, 2020. The new framework will maintain a physician funding at the current $5.4 billion, the highest level it's ever been, and Alberta will continue to have among the highest paid physicians in all of Canada. I think the impact on a patient is being able to know that you have the time with your physician, the impact on the physician to know that they can spend more time on patient care rather than keeping track of every fee code that they, if a family physician is seeing an average of 22 patients a day, how many fee codes is that you're tracking every day? Being able to spend that time with your staff and your patients, I think is fantastic. So I think it's great news for patients to know that this is about us trying to say, if we're going to spend $5.4 billion on physician compensation, how do we make sure we're using that in the best way for patients so that we're making sure we got more care in the system? And that's what our focus is on the changes we're making, is how do we make sure the patients have more care.